Here we go.
Are we live?
Yeah, we live.
All right, awesome.
Hey, so thank you guys so much for joining today. So, fortunately today, I have Perry Hooper here with me, co-resident and fellow skin doctor. And so we're live on YouTube, Twitch, and also on TikTok. And Perry's gonna get some of the questions pulled up. We'll be answering questions from YouTube, TikTok, and Twitch.
Let you get this pulled up for us.
So, yeah, you can go ahead and introduce yourself, bro, if you want.
Yeah, absolutely. Hi, everyone. I'm Perry. I'm a coworker with Dylan, and looking forward to answering some questions and hopefully helping some people out today.
So we'll see what you guys got.
Looking forward to answering some questions.
Let's try.
Hopefully helping some people out today.
There we go.
Yeah, awesome.
So we got Daddy's Bad Girl here. Hey, what's up?
I like to
Let's
see.
see.
Lawrence, so I hear. Are you a dermatologist? Yes.
So, yeah, so we're skin doctors
Yeah.
in residency. I'm almost done. I've got about 6 months left or so. And then, and if you want to go ahead and pull up YouTube on that and pull up Twitch. Or I'll see it. Yeah, thanks. So thank you guys for joining. It's real good having you guys.
All right. So Daddy's Bad Girl asked, "Can I ask what is the best skincare for pimples?"
Yeah, you want to field that?
Yeah. So I think it's a really good question. So number one, you want to find a facial cleanser that is acne friendly. So that can be either something that's non-comedogenic or non-acne forming. I usually say try to find something mild. There's a lot of good brands out there. The other thing you can do is use a topical retinoid. One over the counter is called adapalene, and I think those are both really good starters. The thing I tell my patients with acne, and I think it's one of the most difficult diseases to treat, not for me, it's easy because I just give out the meds, but it's one of those things you have to be diligent for at least 2 months a lot of times before you see improvement. I think that's really hard because, like, if you're me, I use something for a couple days. If it doesn't work, I want to toss it. But in reality, you really have to stay diligent for 2 months of skincare before you're going to see those results. So I'd say that's probably one of the biggest hurdles that I have with my patients.
For sure. And the other thing is, like, when people are using these topical skincare products, it's like they're probably going to get a little bit more irritated, and their acne may even get a little bit worse. We see that on social media. Everyone talks about, like, purging. And it probably doesn't happen all the time, but we're in patients usually. They may get a little worse before they get better, and that can be frustrating for people. They may think they have an allergy to the product or that it doesn't work for their skin, but really it's more of just an irritation from the topical retinoid. Almost all the acne products that we use are somewhat irritating to people. So start it slow and just be consistent with it, and that's the key. And on YouTube, we got Zanfu that's here. So, hey, what's up, Zanfu? Good to see you.
Okay, awesome. So this is a good question, Dylan. Medicat asks, what can I do for bad dark circles under your eyes?
Okay. So, yeah, that's a real common question. Dark circles are trouble for a lot of people, and sometimes it can be genetic. And that's kind of the nature of it. But there's a lot of other things. Like a lot of it's the way that the light reflects off our eye. So sometimes under eye fillers with a dermatologist can be helpful. Mm-hmm. Using a good eye cream. I've had a lot of people that have used like an $8 eye cream from the ordinary caffeine eye serum, and it really helps with puffiness. I know people personally that have used it. A lot of followers that use it and like it, and it's only $8. So that's a good option. If you're wanting to spend some money, there's a good brand called Neocutis, and they have a lot of technology that goes into their products and good research studies that show efficacy. So I would check out Neocutis. They're very good too. So Alastin's another nice brand. So
I agree with all that.
Yeah.
So I have another question. This is from FavZ2. What's the best sunscreen for skin of color and acne-prone skin and also sensitive skin? So I will just say in general, let me tackle the sensitive skin part. A lot of people with sensitive skin will find out that in chemical-based sunscreens that they'll have more reactions as opposed to a physical barrier. So I think things with like zinc oxide or titanium oxide are a little bit better sometimes for people that find themselves breaking out to different types of sunscreen. And so I know there's a lot of good products out there that have those in them.
Yeah, so I'd say generally, like, using chemical-based sunscreens, you're probably going to do a little bit better with because they tend to produce less of a white cast.
Sure.
The old-school zinc oxide sunscreens, they're pretty known for putting a white cast on the skin. However, there's now like micronized zinc oxide that like Elta MD makes, for example, and Elta MD is awesome. It pretty much leaves no white cast, and some of them are tinted, and it just kind of depends. You got to see if that works for your skin. I would recommend going to some place like Sephora, Ulta, something like that, and actually sampling a few of the sunscreens, and then you don't spend the money on it.
Sure.
And that's nice. So,
All right.
there's a couple things here. I'm trying to see. We had a couple. So Zon Fu and PKim asked some questions on YouTube. Is it safe to use threading for removal of facial hair without stopping the use of adapalene? So I think threading, honestly, is I think that's kind of safe. I mean, you might be prone to get a little bit more irritation. You ever had your eyebrows threaded?
I've never had my eyebrows threaded, but I have had patients come in
Yeah.
that do the threading. And in general, I don't think it's just like he said. You're doing two things now that can irritate the skin as opposed to one. So I do think people sometimes experience a little bit more irritation.
Right. Yeah, definitely. I mean, you definitely don't want to get waxing. That's gonna like literally take off. I mean, adapalene and things like that. It thins out that top layer of your skin. It makes your skin a whole lot more sensitive. So I would definitely stop that if you're gonna get waxing done. And then Sylvia Portillo asked, I want to know what the best retinol eye cream is. So if you're just looking for something cheap and easy, you could get the CeraVe one. It's real affordable and easy. You could try that. And then we got one other question from Zon Fu here. Let's see. And it was asking about, let's see here. You can grab one real quick.
Sure. So Holly Vine asked, is it possible to prevent milia? I think that's a really interesting question. There's nothing I can think of in particular that, like as a preventative measure. I think always we're going to say sun protection. That's going to cause the least amount of aging in the skin. Milia in general, if you have some, are fairly easily expressed by a dermatologist. I would urge you to go to somebody that's trained to have them removed. But if you notice that you're getting a lot of those, I think a dermatologist most of the time can remove those pretty quickly.
Yeah, I think for people with milia, I mean, the biggest thing is just like physically removing them. And it's nice. I mean, insurance isn't often going to cover it, but you can just pop into a dermatologist's office.
Sure.
You can pay a small cosmetic fee, and you can leave safe and happy. You don't have to worry about doing something at home. It's going to leave you with hyperpigmentation or possibly not get rid of it. But just know when you come in, it may be $100 or something like that, but you can get them treated and leave happy.
Yeah, and if you have somebody do it that's not well trained, doesn't know what to do, it can always leave you with a scar. So that's why I always tell people, be careful trying to take them out on your own or doing things like that, because worst case scenario is you're left with something that's more noticeable than the milia was at first.
Yeah, exactly.
I got a comment from I'm Namron. I'm sure I'm butchering that. Said we have the same hairstyle.
Oh yeah, there we go. It's true. It's true. Looks good, right?
All right, I had one. So we got quite a few. So this is a great question. I'm going to address this. I'm looking for a good skincare routine. I don't know where to begin or what I can mix. I think it's a great question. So I think there are two general types of products that I tell everybody that's looking for a good skincare routine. Number one, and probably number two and number three, are a good sunscreen. A daily sunscreen you put on every day. The sun is what causes a lot of wrinkles. It causes a lot of our aging that we see. And so if you're like, what can I do to take the best care of my skin? Number one is protect it from the sun. I think that's best done even